how do I know if my baby is getting enough when it comes to breastfeeding? So when it comes to breastfeeding, this is a very, very common concern because due to different cultural aspects, due to different, maybe it could even be because just because you're a novice, you're new to this. Um, we just don't know what to expect sometimes, and we may have misguided, we may be misguided, we may have misinformation. Something that is commonly suggested is to look at diaper output. I'm here to say the diaper output is not a good method for knowing if your baby is drinking enough um, breast milk for so many reasons. But just to name a few, first of all, how do you know if your baby peed in a diaper once or twice or whatever the case may be? Part of the output could be not only breast milk, but it could be leftover IV fluids, depending on what happened in the hospital. If you were at the hospital, it could be many different things. And it's just not a reliable indicator. It's something that would literally have to, for weeks, it would have to be followed. Sometimes parents are told that their baby has lost weight after birth, or that baby needs to hurry and gain weight. And so that kind of creates an anxiety in the parents' minds because no one wants their baby to be losing weight once their baby is born. I'm here to say though that some weight loss is normal. Some weight loss is normal. There are so many things that happen with birth, especially thinking about the fact that the entire time your baby is in utero, your baby is constantly being fed through the placenta, and that changes after birth. And so obviously there's an adjustment there. Another thing that is a factor other than milk intake after birth can be even something as simple as it's simple but it's complex at the same time, as the amount of blood volume that your baby has depending on what happened with the placenta after birth. These are things that we have to consider. Let's see, if the baby was born heavier, if the baby was surgically born, sometimes even girls and earlier born babies lose more weight after birth. It's just weight gain is something that it's a bit of a factor, but it's not a total indicator of if your baby is getting enough milk. A few challenges that do come up, though, I will say, which can be caused by many things, but a few culprits could be latch, pumping issues, blocked ducts, infrequent removal of milk, or restricting the length of feeds, not feeding the baby long enough when it is time for the baby to go ahead and eat. These different things can cause engorgement, can cause cracked nipples, maybe even mastitis, and that can present challenges with breastfeeding that may even make you wonder if your baby is getting enough milk or not. Because just think about it, if you're super engorged after birth, which is common because you have that period where your milk comes in and you have this abundance of milk when your body is trying to calibrate. or trying to learn or listen to your baby to find out, okay, well, how much milk does your baby actually need or want? So you have so much milk and you may feel like your baby is not drinking enough of it, but it's just your body trying to figure the situation out. Another situation that may cause challenges is surgeries around the time of birth, and drugs. When I say drugs, I don't necessarily mean drugs like street drugs, but I mean it's drugs such as epidurals, spinal medications, those different things like that can make breastfeeding more difficult. It can make it a hard situation. Even IV fluids can cause swelling that makes for a difficult latch and make it harder for the baby to actually feed and hinder the natural oxytocin that'll go in between mom and baby on that immediate postpartum period. What I would like to say to ensure that you have the optimal breastfeeding experience, especially in the beginning, because the beginning is what is critical, because that is the learning phase. That's when mom and baby is learning what to do and how to do it and how they are comfortable and what it looks like for them. Is first of all, is to just have realistic expectations. Breastfed babies in general, they have really, 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 really tiny stomachs. Tiny. At the onset of birth, babies' tummies are the size of a cherry. So even that little bottle that they have in the hospital, that is a lot of milk. By day 3, the baby's tummy is no bigger than a walnut. At 1 month, it may be the size of an egg, which is only about 2.5, max 5 ounces. If that is a really like a baby that's really chugging. Most babies don't drink that much though. But it's just, I say this to say, have realistic expectations and remember that they have really, really tiny tummies. So we want to feed often, but we don't want to necessarily overfeed. We don't want to expect that they're going to drink 8 ounces of milk at a time, or it's different for every baby, but we just want to expect that they don't need much. The body knows what nutrients to give the baby. The body knows how much to give the baby, and we have to put trust in that. Another tip is to feed on demand. If your baby want to eat, feed the baby. Even if the baby just ate 30 minutes ago. If the baby is showing signs of wanting another feed, then go ahead and do that. Skin to skin contact is vital. We want to keep that baby on us. We want that baby to be able to smell us and encourage oxytocin release. That'll also reduce anxiety and depression symptoms within the breastfeeding parent as well. Don't skip night feeds. We all want our babies to feed. We all want our babies to sleep through the night, but it's unrealistic because babies are biologically engineered to feed every so many hours, and when they're ready to sleep through the night, they will. And allow that baby to go ahead and initiate breastfeeding or chest feeding in that golden hour right after birth. It's the perfect start. Like I said, I just want to encourage parents to trust in the breastfeeding process and know that most of the time issues with breastfeeding are not really issues. It's a matter of misinformation, or it's a matter of needing to just kind of work at it a little bit between both parent and baby, because it's a new experience. We out.